As you know, we've embarked, as many of you know, we've embarked upon a major campaign a year and a half, 2 years ago, investing in our community with significant projects, including our Advanced Technology Center at the former Sony site, now Westmoreland RIDC, a new educational center in downtown Latrobe, and most significantly for today's event, the expansion and development of our healthcare programs, including nursing and many other areas. So today we have representatives from Highmark to make a special announcement, and making the announcement will be Mr. Dan Anuradha, and let me do his introduction. Mr. Onorato is the Executive Vice President, Public Policy and Chief Government Relations and Community Affairs Officer of Highmark Health, which is the parent company of Highmark Inc., provider of health insurance, dental insurance, and vision care. Highmark Health is also the parent company for an integrated delivery healthcare network that includes 7 hospitals, physicians organizations, a group purchasing organization, and ambulatory surgery centers. Mr. Onorato has a broad portfolio of responsibilities, including government and regulatory affairs, community investment, and public policy. He serves as chairman of the Highmark Foundation, executive director of the Caring Foundation, and on both the board of directors and the executive committee of the Jefferson Foundation. Before he joined Highmark, Mr. Onorato served 2 terms as the chief executive for Allegheny County. It is my pleasure to welcome and introduce Mr. Dan Anuradha.
Thank you, Dr. Barra. Good morning, everyone.
Good morning.
It's great to be here. On that introduction, you heard all the different departments that I sort of oversee, but the main one today is the corporate giving part, which is a pleasure for me because any of you that know me from my prior life, I spent 20 years, last 20 years, basically asking people for money, and now I give money. So it's a lot. I'm going to balance it all out over the next 10 years. Before I get started on some comments, I do want to recognize the people from Highmark that are with me today. Mary Ann Papali, if you can just raise your hand so we can see who you are. Mark Jones, Janice Maisel, Derek Huber, and Rick Coco. They are all over here together, all scattered around. So we have the Highmark reps with us too, and I appreciate them being here today. I know you recognize the commissioners, Commissioner Anderson and Courtney and Copus. Let me say hello. Former colleagues of mine, being the former county executive of Allegheny County. I know what they have to deal with, and I know how important community colleges are, especially as it relates to the local match and the local sponsorship to get the state money, and then obviously a third coming from the students. So it's a struggle in some tight budgetary times, but I think we can all agree that community college might be the most significant asset that we have in our communities as it prepares people for the workforce, and also makes us competitive for employers that want to be here. So that's why I was glad I could make it out here today, because I sort of have a soft spot for community colleges and the importance of them. So let me just say a few words, and we'll get on to the presentation too. And while it's a gorgeous Friday, it's sunny. It was a nice trip up here to Westmoreland County from downtown Pittsburgh today. I'm glad to be here with all of you today. I'm glad to be representing Highmark Blue Cross Blue Shield. I really appreciate you, Doctor, for hosting this right here in this beautiful facility. As you know, Highmark and Blue Cross, our mission is very clear. We want to provide quality health care, make it easily accessible, understandable, and affordable. Foremost, we do that through our highly dependable health insurance coverage that provides benefits to keep you well and medical benefits when you need them the most. If it's for surgery, tending to a chronic disease, or giving birth to a newborn. We're in 29 counties that we serve in Western Pennsylvania. And next to Allegheny County, our highest number of members are right here in Westmoreland County. So that's one of the reasons why we're glad to be here today. It's a privilege to be an important part of so many lives in this community. And with that privilege, we assume the responsibility to give back to the community, to work and to keep healthcare accessible, understandable, and affordable, but also to work with you to improve upon the healthcare that is delivered in the community. As you know, Westmoreland County Community College plays an important role in training the talent that we keep right here in Western Pennsylvania. You are training students in vitally important jobs, including nursing, radiology technology, medical residence imaging, specimen processing, and sonography, getting students ready to deliver these crucial healthcare services in the community. And upon graduation, most of your students elect to stay right here. And that's the beauty of community colleges. We're training people that are really going to be in our communities for the next 20 to 30 years. They're supporting hospitals, doctors' offices, clinics, and other medical facilities that serve Westmoreland, Fayette, Greene, and Indiana counties. But we know that the college and the students can't do it alone. They need support and funding assistance from the community partners such as Highmark, especially as colleges continue to grow and expand and public money becomes very sparse. That is why we're here today. Westmoreland County Community College reached out to Highmark and they asked for help to improve the career development and coaching for students in the nursing and allied health profession. Doctors Onorato, Malloy, and Irwin want to reach students earlier, getting high school students interested and prepared for healthcare. And this is key. They want to bring aboard a career coach to walk with the students by providing ongoing career planning while they're here. They want to have a better finger on the pulse of evolving workforce. And one of the things that we discovered, I know in Allegheny County, and you obviously are doing it here, is to make sure that what this great institution is training the students to be actually matches the needs for the employers that are out there. And that's what this program does. You're preparing the healthcare professionals for the jobs that are needed for the next 10 to 20 years. And having this bridge and this coach will go a long way making sure that the students they don't just come through the doors, go to class and learn something, but they also understand that bridge to the employers and the opportunities that are out there. Highmark was glad to say yes to the offer. We could be more relevant. We want to be more relevant in improving healthcare in the region and strengthening the bond between the young people, the educational system, and the employers who support the healthcare delivery systems there. Students in the region can bring their ambition and their talent. Westmoreland County College can provide the excellent training, but strong career coaching and partnerships is something that we have to pull together. With that, Highmark Blue Cross Blue Shield is proud to be here today. And we're going to deliver a $50,000 check for the coaching program. And I hope this is the beginning of a strong relationship, and we're back here in the future on different programs because we're constantly looking for ways to spend our significant but limited resources in ways that get the biggest bang for our buck. We are able to support more and better trained healthcare professions everywhere in the community and make sure that the community remains healthier for the individuals and families and children and the entrepreneurs that they serve. So today, when I'm about to present this to the good doctor, I do want to say that the students and the employers, there's nothing more important than making sure that connection takes place. I was stunned years ago when I found out how much we were spending on curriculums and training for jobs that didn't exist. And there were only so much money we could spend that we stepped back a second and we went out and talked to the employers and found out where the needs were. And I know in Allegheny County, about 8 years ago, Allegheny County Community College became the largest trainer of nurses for the healthcare systems in Western Pennsylvania in the Allegheny County Centered area. To be here today on behalf of Highmark and being able to get a $50,000 check to make sure that we service the great facilities like Excella right here in Westmoreland County and the other community hospitals throughout the 4 or 5 county regions that you serve is key. These kids have a great opportunity to have a great career, family sustainable job, and at the same time providing great health care for our community as this community ages and as healthcare is rapidly changing. So I couldn't think of a better program for Highmark to be part of and be affiliated with. Dr. Barron, thank you for giving us this opportunity, and let me present this to you now on behalf of Highmark and our 37,000 employees. There we go. Thank you. Right, you got it? Got it.
I got it.
Okay.
Well, thank you so very much for this generous gift from Highmark and I think you outlined the purposes of the gift very well so that we can better align our training of our healthcare students for the jobs that are really needed for our local communities. And as you indicated, 95% of our students stay within our service area of the 4 counties in southwest Pennsylvania. We do get a few that go over to Allegheny as well. But we're really take very seriously our mission of serving our local communities and providing well-qualified healthcare professionals for the providers throughout the area. We have a few individuals who are very key to our programs here at Westmoreland County Community College who will say a few words. First is Dr. Cathy Malloy, who is our Dean of Healthcare Professions here at Westmoreland County Community College. Cathy, Dr. Malloy.
Thank you, Dr. Vera and Mr. Onorato. I was watching television the other week, and all the big hype was about the Oscars. So I thought I might tune in and watch some of the events. Everyone was so excited about the red carpet and who was wearing what and who was designed by who. And everybody just wanted to be where all the action was. Being where the action is seems to be the theme right now. Well, let me tell you, I'm a nurse working in healthcare career education in a community college located in southwestern Pennsylvania, partnering with Highmark, whose mission is to make quality healthcare easily accessible and understandable and affordable. Now that is what I call being where the action is. As you might guess, I am fortunate to have a job where I make a difference and also receive so much personal and professional satisfaction. My hope is that our graduates of our health profession programs here at WCCC have the same opportunity as I have had. They have spent time at the college with us studying hard and balancing work and families, and when they complete their program, I wish that they find the same satisfaction in their career job choice as I had. The generous grant from Highmark will assist us to help develop a career coach for the WCCC's health professions programs to connect and network with regional employers. Currently at WCCC, we have credit programs in RN nursing, radiology technology, which is X-ray, MRI, diagnostic medical sonography, also known as ultrasound, dental hygiene, dental assisting, expanded function dental assisting, phlebotomy, lab specimen processing, clinical laboratory technician, and medical assisting. What is important for this audience to know is that all of these programs are high priority healthcare occupations which lead to entry-level jobs in healthcare throughout the southwestern PA region. The Career Coach, funded by the Highmark Grant, will assist our students to explore and prepare for career jobs upon graduation that best match their talents, goals, and career pathways. The Career Coach will help them with the actual job search and all those processes related to finding the best job fit. In addition, the Career Coach can help those students currently attending classes to ensure that they are making correct academic decisions. So you don't need to spend all that money flying to LA to be on the red carpet to be where all the action is. You can stay right here with me at WCCC and really be in the hub of the real action. Being part of the education of our future healthcare workers, working with regional employers to match new employees with their organizational philosophy and goals, and collaborating with Highmark, who gives back daily to our region, all to make the difference in the quality of health care for southwestern Pennsylvania. That, my friends, is where the action is. Thank you.
Thank you, Dr. Malloy. We will now hear from our Director of the Nursing Program here at Westmoreland County Community College, Dr. Ruth Irwin.
Well, I feel like I just walked the red carpet. Dr. Malloy. Good morning.
Good morning.
I would like to thank Highmark Blue Cross Blue Shield for the receipt of this $50,000 grant to support the career coaching position for our allied health and nursing. One challenge, a huge challenge faced by the students in the nursing program is balancing the last semester of school along with the ever-present thought of where will I find my first job? Who is hiring? And is it the specialty I think I want? This person will help students not only enrolled at the Youngwood campus, but at our Indiana and Green Education Centers where our nursing program is taught. Graduates of the Westmoreland County Community College Nursing Program are employed throughout Westmoreland County, as we've heard, throughout southwestern Pennsylvania, West Virginia, and Ohio. The outreach and networking with these communities and within these communities is all within our service areas. This career counselor, funded by the Highmark Blue Cross Blue Shield grant, will be instrumental in helping students focus on making job applications where institutions are hiring, especially in the specialty they seek. The role of keeping in touch with the area healthcare providers will enable students to have a resource during job hunting. This will streamline the job search process for our students, enable them to focus on good potential matches versus the widespread submission of applications to all facilities. Additionally, guidance in the application process, resume development, and helping with just even job interview skills will assist these students greatly. One part that Dr. Malloy referenced was that this coach will also help in the recruiting of applicants and candidates to our health programs. And that starts in the middle school area, and we're excited to have this resource person to help facilitate this. So with those words, I want to thank you.
Before I introduce our next speaker, I want to recognize Lou Lazaro. Sorry, I missed you, Lou. Lou, of course, represents Congressman Murphy's office. Thanks for being here. Very dedicated to the college. Our next speaker is one of our nursing students, Mr. John Wheelis. And I think he's fairly typical of our nursing students. He spent many years in the hospitality restaurant management industry, and then decided he wanted a change of career, and he actually earned an associate degree in restaurant management here at Westmoreland County Community College. Then shifted gears and is pursuing a career in terms of nursing and health professions. So John's going to say a few words to us. John Wheelis.
Thank you, Dr. Rivera, and thank you, Highmark, for helping improve an already great nursing program. It's an honor to speak with you today. I have a lot of pride for WCCC and a lot of gratitude for everything that WCCC has done for me. It's the place where I found out that I am smart and that I can do anything I put my mind to and learn anything that I put my mind to. Because in high school, I was too immature, wasn't interested in learning as much, but this is the place where I found out how important learning is. So I want to thank all the staff and faculty here for everything you do for the students, because you set it up so we can succeed if we choose to. After I completed my associate's degree, I had to decide what my next move was with moving on to further my education. After a lot of prayer and contemplating, I'm glad that I ended up here in the nursing program. Now, ultimately, of course, like a lot of my students, I know when you first sign up for nursing, you don't know if it's going to be 100% fit for you. Especially after that first bed bath, that's when you really consider, is this right for me? But I found out last semester that this is definitely the fit for me, and it's a job that I can not only, like people have said, provide for a family, but I can help people on a daily basis. And And I treat, like, one of the benefits of nursing school is you don't have to wait to get out of college to start helping people. When we're clinical these days, Wednesdays and Fridays, we already get to help so many people. And I enjoy making these patients who are having a hard time have a little bit better of a day. And oftentimes, especially with this winter, their families couldn't make it out and there wasn't anyone coming to visit them, but there was a student there who had time to invest in them. And you know, it was a two-way street. I learned from them and I was also helping them at the same time. So I know that nursing is going to be a fulfilling career for me, and the best thing is to get in a career that you know is right for you. And I know that as a student living through it, and also other students who I've heard say that, you know, like, what am I going to do for my life? That's one of the hardest questions you ask as a young person. And I believe, thanks to Highmark, that in this grant for a career coach, it will better help other students find that answer. What will I do with my life? And not only once they make the decision for nursing, but what area of study do we want to do? Because we all know there's so many options in nursing, and that's one of my favorite things about it. But this career coach could help focus our attention on what fits best for us as a student and a graduate nurse, and in turn that will help us give better care to our patients. So I'm real excited for what this is going to do for next year's students, and because like I said, I'll be an alumni here forever. I love WCCC. It's really invested in my life, and that's all I got. Thank you.
Thank you.